we come here is the learning of the new guidelines.
The glitz that comes with a new dawn. The government promises to deliver an HIV-free country.
By 2030, HIV will no longer be a public health issue. Yeah? A major public health issue. That's the kind of dream we have, and all of us must then work collectively to achieve that.
Currently, about 900,000 Kenyans are getting free treatment from the government from the possible 1.5 million Kenyans living with the virus. For the new campaign, dubbed ANZA SASA, to come to fruition, all groups must be included in the treatment program, more so the vulnerable ones whose challenges keep morphing. I am on River Road in search of one of the groups that contributes to about 33% of new infections in the country, according to government statistics. Male sex workers hang around this bar. They call such joints hotspots. They, however, advise that we move to a more safer place as we cannot film inside.
Kwa kuwa at least tunajihimiri kukaa vile tulivyo, juu ndipo wateja waweza kufanya nini? Kukuona, na sasa uweze kuwa sexy kwa wateja. Uweze ukafahamu yani maura manini vitu mob hawatafurahisha. Wateja wanataka kuona the body structure na vile uko ndio wapasa kufanya nini kukubeba.
I'm called Daniel Mugoya. I'm a sex worker. I've been in the business for almost 15 years. And the results of my business have not been so good because I end up being HIV positive. And on the streets, we always have a lot of difficulties because we always get clients who are not always so faithful to us. Some, they make gang rapes on us, and others, they don't pay us.
A refugee from Uganda, these streets have become his source of income, but at a painful cost. He insists that although he is HIV positive and in need of treatment for various ailments, he will not be attended to by a woman.
And if I'm going for any clinic, I want to meet a man, because if it's like last month I got anal wax. Like a woman can't look there, and I cannot allow. I want a doctor who is with an MSM like me.
Isn't that selfish though, that you know you're HIV positive and you want to choose the doctor who treats you?
It's not. It's for my own safety. Because most doctors, as in the past, one of my friends was talked about because of being a gay, and it was because of a doctor who was straight.
The government says it is fully aware of these challenges and is meeting them at their point of need. The strategy is to ensure that they have running programs at the hotspots where the male sex workers frequent. Sometimes the need to make an extra shilling supersedes the need for protection.
They have get the client, and a client can access a big bunch of money, so you accept the money without the condoms. But the time that you get the condoms, they reduct the money.
I'm told I'm infected, so I had no other option just to start up using the drugs via ARV. But right now, I still cannot access them because I'm not having enough wellness centers to have the drugs.
We have set up health facilities, and we are using key populations themselves as healthcare providers. And since they know where their colleagues are, it's very easy for them to come into care. It's very easy for them to engage at a personal level.
The government estimates that there are about 20,000 male sex workers in the country. This poses a challenge in the fight against HIV, especially because these men are also going out with other men who are married, and as they wander off to the night to seek the next client, the risks notwithstanding, the question still begs, will Kenya eradicate HIV by 2030? For Citizen Weekend, I am Anne Mawade.